Welcome, everyone. My name is Bara Vaida. I am the Director of Training for the National Press Club's Journalism Institute, the nonprofit affiliate of the National Press Club. We're so glad to have you here today for today's program, Uncovering Firearm Violence, how journalists can reframe their reporting. Today's program was developed with support of the Association of Healthcare Journalists, which represents health journalists across the country. Before we get started, I want to begin with a few housekeeping items. We have a live transcription option, which is available to you anytime during the program. The instructions are in the chat. And we'll be recording this program. A link to the video will be emailed to you. So if you miss something, don't worry, you'll have a chance to catch it a second time. Highlights from the program will also appear on our website and in our newsletter, The Latest, with the video. And if you aren't already receiving the Institute's daily newsletter for journalists, it's free and you can subscribe now. Got a link there in the chat. And today's program is designed to be a conversation, and we hope you'll join in with comments and questions. Please go ahead and put them in the chat when wherever you're tuning in from. Please put that in the chat, but also if you have questions, go ahead and put them in there and not in the Q&A section. We'll be monitoring your questions and responding to them. So from here, I'm going to turn the program over to Caitlin Washburn. She is the Health Beat Leader for Firearm Violence and Trauma for the Association of Healthcare Journalists, and she's also a reporter for the Chicago Sun-Times. She'll be framing this issue and guiding the conversation, and we hope you all leave with some practical tips to help you with the reporting. Thanks so much, Caitlin. Take it from here.
Thank you, Bara. So today we're going to be talking about firearm violence and how we as an industry can do a better job covering this important topic. Firearm violence is largely covered in the media as an episodic and sensationalized crime issue, focusing on individual shooting events. But experts say this framing in media is making things worse, and it's crucial for us to find another way to report on gun violence that creates a pathway for community leaders to implement policies and solutions that prevent deaths and injuries from guns. I'm really excited to introduce our three panelists because they're already doing this crucial work in one way or another. And today we're going to be talking about some of the definitions of different types of firearm violence. We're also going to talk about research, and we're going to leave you with some practical tips that you can take back in your own reporting into your own newsrooms for reframing your coverage and improving how we report on this topic. In the interest of time, I'm not going to read off everyone's very impressive bios, but I will introduce everyone in order of speaking. And then for the next 45 minutes, we're pretty much just going to have a conversation. This isn't a lecture, and we'll leave a good amount of time, about 30 minutes at the end for Q&A. So feel free to be dropping your questions in the chat throughout, and we'll make sure to cover those in the second half of our conversation. So I'm first going to introduce Jennifer Macia. She's a senior news writer and the founding staffer at the Trace. Then we also have Abené Clayton. She's a reporter at The Guardian on their Guns and Lies in America project. And then we have Dr. Jessica Beard, who's a trauma surgeon and the director of research for the Philadelphia Center for Gun Violence Reporting. So I think to get us started here, I'd like to establish some different definitions around types of gun violence. One that's often misunderstood and one of the most misunderstood because there isn't actually a formal definition for it as a mass shooting. And despite often getting the most amount of media attention, mass shootings make up a very small percentage of overall shootings. And there's a disparity too between what kinds of mass shootings are getting that amount of attention. So I'd like to start with what is a mass shooting. And I also want to, then within that, there is something called a mass casualty event. So I want to establish both the similarities and the differences between those two terms. I think I want Jen to get us started on that. Thank you.
Thanks, Caitlin. So yeah, as Caitlin said, there is no federal official definition for a mass shooting. So what do we have? In 2013, Congress defined mass killing as 3 or more killings in a single incident. But and that was really only to give the Attorney General authority after Sandy Hook to step in and investigate these incidents. But it doesn't specify the type of weapon, and it doesn't account for injuries. You know, you can have lifelong debilitating injuries from these shootings and even die years later. So that's part of the story that's not told by that definition. At the state level, only New York and Texas have official definitions for mass shooting. And those are relatively new. The CDC has gun death figures, but it doesn't have data on mass shootings. FBI crime data is only voluntarily reported by states. A lot of people don't know that, and it's incomplete. So that leaves the media, that leaves us to figure out what to call it when someone shoots multiple people. The easiest thing for journalists to do is to defer to a legal definition, but we can't. So in the absence of one, media outlets are left to their own devices, and there's no agreed upon definition there. We know what a Category 5 hurricane is. We know what a 6.0 on the Richter scale is. We know what stage 4 cancer is, but we don't have parameters for this, which seems strange because we have lived through a decade of one catastrophic mass shooting after another. But that is because this is still a relatively recent phenomenon. A decade ago, I went back and looked through some news clips. We didn't tally up annual mass shootings like we do now. If there was a bad mass shooting, a newspaper might give a rundown of like the deadliest mass shootings and where this new one ranked, and mention other bad mass shootings that month or that year, but it was not comprehensive. Now we hear 600 mass shootings a year. What does that mean? Well, that tally comes from the Gun Violence Archive, and that's only been since 2014 when Gun Violence Archive launched. They're a nonprofit that has around 24 people compiling news reports and police reports. And that's the closest thing we have to a database of near real-time shootings. They're about 24 hours behind. And it has details of shootings that we would otherwise not know. Gun Violence Archive is cited by CNN, which is the most prominent, probably BBC. And GVA considers a mass shooting 4 people shot, regardless of outcome, whether they survive. That is not counting the perpetrator. So their argument is that, you know, advances in trauma care mean that victims who might have died 25 years ago might live today. So yesterday's death toll might be today's injury toll. And anyway, the perpetrator was probably wounding to kill. So according to this metric, you know, people say it's a much more fair depiction of what's happening out there. There were 656 mass shootings in 2023. So that describes the problem as very massive. Now, the FBI doesn't have an official definition of mass shooting either, but they define mass murder as 4 people killed in a single event. By that metric, there were 41 mass gun murders in 2023. Even by that narrower definition, that's more than twice as many as we had a decade ago. There were 17 mass gun murders in 2013. So even when we just look at the worst of the worst shootings, the problem is growing. The Washington Post and AP use the 4 killed definition, but that leaves out shootings that leave large numbers of people injured, like shootings that happen outside. It leaves out the Brooklyn subway shooting of 2022. 10 people were wounded. The 2019 Brownsville shooting. Narrower definitions leave out people who've been historically harmed by mass casualty violence, like 10 people wounded in a community of color. Why doesn't that break into national news? A school security expert told my colleague Chip Brownlee last week, how do you tell 27 people struck by gunfire that it wasn't a mass shooting? So then there are news outlets who even still now use a narrower definition, counting a mass shooting only as an incident that takes place in public and isn't connected to any other crime like street violence or domestic violence. There's an organization that counts just these 2. It's called the Violence Project. By that metric, there were 8 mass shootings last year. But that leaves out family annihilations, which are almost entirely a gun-related phenomenon. So that stat is missing another important piece of the gun violence story. So why does this matter? So one function of the news, right, at its most core level is to warn the public of danger, fire, flood, earthquake, war. A gunman opening fire indiscriminately in a public place is seen as a greater danger than a domestic murder suicide. But many mass shootings begin as domestic shootings. So even there, narrower definitions fail to capture the whole story, which is that it could begin as personal violence, but the public still bears a cost because these shootings move into the public realm. And at this point, it's worth asking, why do we only count the worst of the worst? Mass shootings are the most visible manifestation of gun violence, but they only accounted for, and I crunched the numbers last night at Gun Violence Archive, 1.5% of gun deaths in 2023. 56% of gun deaths in 2023 were suicides. The rest were homicides, unintentional shootings, and police shootings. So when our gun violence coverage is led by mass shootings, we are not seeing the big picture. But often, it's the only choice we have because the vast majority of outlets aren't devoted exclusively to gun violence and many of them don't even have distinct gun violence beats. I suspect that'll change in the next 20 years. But even then, it's impossible to cover every death or every homicide, never mind every injury, because there are just so many shootings. And that thought alone is sobering. And that sets us apart from almost every other country. We only focus on the worst of the worst because there are too many shootings. At a webinar last week, the Violence Project had, and remember, they have the really narrow definition that only counts 8 mass shootings in 2023. They said they would love to expand their definition of mass shooting and grow their database. They don't have the manpower. So these definitions, while they can be used politically, saying there were 41 mass shootings or 8 mass shootings is better for, a gun rights advocate than 656 mass shootings. But, these definitions are a function of not having enough resources to cover every shooting. The question then becomes, how can we tell the rest of the gun violence story? And that's something that, my co-panelists are about to talk about. So.
Thank you so much, Jennifer. That really outlined it so well. I'll kick it over to you, Abené. Would you like to? Yeah.
Yeah, that was such a helpful and sobering kind of list of definitions that just shows how convoluted and difficult it is to cover this topic. For me, the definitions around mass shootings have really served to obscure and dismiss a lot of the intra-community gun violence that has been foundational to my journalism. I just to like kind of tie it to a story. In 2019, which was not that long ago, there was a mass shooting in a city called Orinda, California, in the Bay Area. It was the first mass shooting I had ever covered. And one of my high school classmates was also killed in this mass shooting. Another thankfully survived by hiding. But I watched the definitions that we were holding so closely to mass shootings end up helping this horrific case go from something that is an indictment of access to firearms to the levels that young
Give her a second. I think she's having some technical difficulties.
about that. But as I was saying, it went from something that could have led to these young people being lionized to a local crime story almost immediately. And one of the things that I ended up writing about was how our lack of a definition, our lack of clarity around what a mass shooting was, made it easy for people to say this wasn't a mass shooting, this was a gang shooting, So for me, it's been really important to use that numerical definition just to ensure we don't dismiss anything that qualifies but doesn't look like a Sandy Hook, that doesn't look like a Parkland. It's not these young, bright, white children that how could this ever happen to them is something that we ask ourselves quite often. And then when the faces of the victims and the suspected shooters started to come out and they were all Black, it was easy for people to say like, oh, okay, it's all good, guys. No, this wasn't a mass shooting. And it was just one of the most horrific things that I had ever I had ever seen. To this day, it kind of bothers me. So I was so glad to hear Jennifer talk about how genuinely complicated it is. And even though it's complicated, that doesn't mean that we should base what we take seriously on where this happened, which we see happen so frequently and does nothing but a disservice to victims because they don't get the level of nuance and thoughtful coverage that comes out of a mass shooting, which, as you mentioned, happen, are about 1% of the nation's gun deaths.
Thank you, Abené. That's such a sobering example. One that I think of is here in Chicago when the Highland Park mass shooting happened a few summers ago. Obviously a very tragic event, but that same day on the South Side, more people died in shootings than they did at the mass shooting that got way more attention. So the disparities in the attention that we give to who are the victims and who's being impacted is really important for us to both understand and then to do a better job of in our coverage. Dr. Beard, I'd like for you to have a chance to jump in on this.
Sure, Caitlin. Thanks so much. And Abené, thank you for sharing that personal story. For me, every few weeks as a trauma surgeon, I'm taking care of people who've been shot in a mass shooting that doesn't make the news as such. So it's, most definitely an equity issue in terms of how we define mass shootings. And there's a lot of complexity. We've done some research to add yet another definition to the ones that Jennifer really summarized very well, thinking about whose perspective we're considering when we're thinking of a mass shooting. So, if you're thinking of the impact on a neighborhood of a high casualty event, you might think of a mass shooting as multiple shootings that occur within space and time. So we've done some research to define and look at how often neighborhood mass shootings happen in Philadelphia. And we define that as, 4 or more people shot, so similar to Gun Violence Archive, within a city block within an hour. If you think about from the hospital's perspective, even 2 or more people coming within 15 minutes, which happens for 1 in 4 people shot, right? 1 in 4 people shot comes within 15 minutes of another person to a Philadelphia area hospital. That's a strain on resources, and it can be, something that is kind of our everyday, but something that's not necessarily recognized as such. And then just to kind of add to the complexity, and one thing that Jennifer didn't mention is this over-reporting on mass shootings is really impacting the way the public is thinking about gun violence. So we know although mass shootings, as more traditionally defined, represent about 1% of shootings, the mass shootings, the neighborhood mass shootings are about 5% of shootings in Philadelphia. So it's still, they're very rare events. But when you ask the public, when you poll the public how common are mass shootings, they think they're the most common type of gun violence, right? So the way that we're reporting on this, the way that we're over-reporting on it, kind of regardless of the definition, is basically misinformation, right? It's resulting in an incomplete or inappropriate public understanding of gun violence. And to add to that, the shootings that make the news are sort of these outdoor, innocent victim shootings. And then the numbers that are held up next to them on CNN, for example, are the Gun Violence Archive shootings, which do encompass, largely community firearm violence. And so there's just so much convolution around it. And I think that a lot more needs to be done to frame mass shootings as the rare events that they are, and that's what needs to be provided when we provide context about mass shootings. The same would be said for covering, shootings of women and children. Things that happen rarely need to be contextualized within their epidemiology.
I think, yeah, just to reiterate what you said, that over coverage of a rare thing is dangerous, and it skews people's perception of the world around them. So it just including that context is so important. Even if it's just a few sentences, it goes a long way. I'm going to move on to our next question, which, with kind of the general approach to news coverage of shootings, it's generally episodic. It's only maybe a few days of attention, and it's largely driven by the police narrative, what the police have to say about what happened. And even when reporters go and do door knocking in neighborhoods where it happened to try and find out what happened, you're usually now only showing up in that neighborhood when you hear a shooting happened. So the impact that both has on victims, on their loved ones, on the members of their community, and on people like frontline healthcare workers who are treating these people when they come in, that does a lot of damage. And even if it's unintended, there are still serious consequences to that kind of coverage. I'm going to go back to you, Dr. Beard, for this to talk through some of these specific examples of how news coverage like this impacts these victims and people like yourself, healthcare workers.
Thank you for that question, Caitlin. And I think you really defined what we're talking about when we talk about episodic reporting really well. But just to reiterate, there's kind of a lot of definitions around here. But this idea of episodic reporting is that you're reporting on a single event. And so the narrative that kind of gets reaffirmed is one of individualism, and the narrator is also very important. So by and large, we're seeing, the narrator is law enforcement or police at the scene, and oftentimes, the report is coming from a crime scene. We have 7,000 television news clips from Philadelphia TV News in 2021, and we found that the vast majority still remain episodic reports. About 80% of TV news clips are episodic reports. And the majority of reports include law enforcement as the only narrator, not just the primary narrator, but actually the only narrator. None of the clips that we looked at had a firearm injured person as a narrator. And none of the clips that we looked at had like a health or public health professional as a narrator. And when we think about the impacts of this style of reporting on gun violence, I think of it as sort of like multi-level harms. So there's the harm to the person that the report is about, and I'll tell you a little bit about research that we've done on that. But there's also harm to the impacted community and to our news audiences and our society sort of more generally. And we've really known for decades that when news audiences view episodic reports on crimes, they tend to blame victims. They don't understand the broader social context or structural context that crime is happening in, or in this case, that gun violence is happening in. And what that leads to is sort of this lack of understanding of its root causes and a lack of understanding of what the solutions are. And unfortunately, the sort of upholding of what is really a false efficacy of police as a means to prevent firearm violence when police are the narrators, and a diminishment of, public health responses that we know now that we're able and allowed to do research on gun violence can be very effective to prevent gun violence. So that's kind of what's happening at the society level, we think, and we know, and we've known for decades. And despite that, a decent amount of effort from the public health community to reach out to journalists and say, hey, stop this is harmful, we're still seeing in 2021 in Philadelphia during this terrible and horrific surge in firearm violence, the same style of reporting that's been known to be harmful. So what does it do to firearm injured people? That's not necessarily been a huge part of the conversation. And that's why that's really the first place that we went for our research. And we went to the trauma clinic at Temple University Hospital, where I'm a trauma surgeon, in 2021. And we asked our patients what they felt, what their perspectives were on the reports on their own injuries. And we found that none of the people that we interviewed were approached by a journalist to tell their story. We found that about half of them didn't see any news reports about their injuries, which goes with our other research that shows that only about half of shootings or community firearm violence incidents make the news. And for the people who didn't make the news, they actually were relieved because they know what news reporting on firearm violence is. They know what episodic crime reports are, and they don't want to have themselves exposed in that way without the opportunity to share or present their narratives. And for the people who did make the news, they really described kind of a preponderance of harms of what we would think of as episodic crime reporting. So first of all, they felt dehumanized by narratives that didn't include their perspectives. The title of our paper is called "Like I'm a Nobody," and that comes from a quotation from one of our participants who said that the report just presented her like a woman shot like a nobody, like she wasn't even a human. They reported that there was reliving of trauma, especially when there was graphic imagery that was shown or explicit content that was shared. When we looked at the TV news clips that I mentioned before, about 8% of the TV news clips actually had a video of the shooting event. So it's not an uncommon thing to see yourself get shot if you're watching the news. And people described how, because those things are often available sort of in a digital fashion or on phones, that they were able to watch those videos over and over again. And that even that type of reporting can glorify the shooter, and that the shooter feels, almost reaffirmed when that type of violence is shared publicly. Another thing that came up was inaccuracies, right? So the police are the narrators of these stories, and even things that we might think are small, like the number of gunshot wounds, which is like just the standard police narrative. When those things are wrong, or they're wrong from the firearm injured person's perspective, that causes pain and trauma. And it can also just be a miscommunication. These folks were shot during the time of, high COVID pandemic, when people were not allowed to visit them. One participant in our study described how, the news report said that he was in critical condition and he was shot 4 times. And he was like, I knew I was fine. I counted the number of shots as 2. And my grandma's watching this news report. She's going to think I'm going to die. So just, all those things added into what we might say the second or the third trauma of being traumatized by the news reports on your own injury. A lot of times, TV news in Philadelphia mentions the hospital, the treating hospital that the person is being cared for at. And that really caused a lot of threats to personal safety, or perceived threats to personal safety. And then more generally, there was a lot of insight around this connection between sensationalized, episodic, harmful reporting on community firearm violence and the creation of this kind of narrative of fear that can lead to gun purchasing, which we know happened during the pandemic, and even to more gun violence. So that's something that we're, looking to explore and are planning to explore in our future research. We do have lots of resources on how to support better gun violence reporting and how to even make episodic stories more humanizing. We have a toolkit that we've been working on with frameworks that came out of our community-based participatory research and human-centered design work with journalists that's been very collaborative throughout, and that we're perfecting, but there's a near final version that's available for you. And then we also have a training program in gun violence prevention reporting that we have launched in the fall, and through the Philadelphia Center for Gun Violence Reporting are hoping to share with journalists who are interested.
Thank you so much, Dr. Beard. I think you just really outlined so well what this issue is and how victims and the people most impacted by this experience this. So I think I'm going to change the question a little bit for Jennifer and Abené as reporters. In your reporting, how do you try to avoid what Dr. Beard just so well outlined? And you can talk in that, what you hear from folks about how that coverage impacts them. But, how do you try to be different? And I'll start with you, Abené.
Thank you so much, Caitlin. So, I feel like my kind of entree to journalism and to gun violence reporting more specifically was really distinct from what I've seen out of or for a lot of my peers. I came in to the Guardian's Guns and Lies in America series, and the entire goal was to expand the kind of focus and reporting priorities from just like high profile mass shootings, which is my like personal distinction between like there are mass shootings that happen in public places, mass shootings that happen in homes, as Jennifer said. So for me, high profile mass shootings, like we've said, you know, some Americans believe that that was like the primary way that people were dying from gunshot wounds, which we know isn't true. You know, it's suicides and then it's homicides, usually like person to person, sometimes in homes, et cetera, et cetera. So when I came into journalism, I was already, you know, I had already had this foundation of talking to people in my hometown. I'm from Richmond, California, and my ideas about gun violence were so informed by seeing the aftermath, by seeing people continuing to like show up to rallies and community events to like call for justice for their like child who was murdered in the early 2000s or 90s, and they never knew what happened. You know, so those were the things that I was already interested in, and there just so happens to be a vacuum for that sort of reporting in like national mainstream press. So coming in with that approach is already different. Just saying my focus is the people who are often left out of these conversations. There just wasn't a lot of that at the time. And thankfully, some of that has changed, not, you know, nearly to the level of the crisis, but it has become different. And we're having conversations like this, which is like a, you know, which is nothing to sneeze at. So as I've been doing this reporting, one of the ways I try to like differentiate myself if I am doing something that is a part of the national news cycle. One thing that I always try to do and also recommend other reporters do is, you know, if you have that police officer or that public information officer's number on speed dial and you know to call them after a shooting, you should also have the phone number of a violence prevention worker. There are always like moms and other parents in a lot of these communities that have had to take it upon themselves to support other victims of gun violence. And those people have a level of expertise that is, you know, spectacular and very rarely tapped into unless it's a story specifically about like, you know, victims of gun violence in this lower income community. It's like, no, those voices need to be included in every story that you do. You know, they have just as much kind of skin in the game, if you will, as police, because they're the ones who have to go and have those personal conversations, figure out who to talk to like address potential retaliation. And like I said, those voices are just left on the cutting room floor so often because we as journalists have a problem kind of expanding our idea of who is an expert. That's something that I feel like comes up so often in these gun violence conversations, like who is an expert, who has the knowledge, who do we as a journalist trust to have enough knowledge to quote them. We make these delineations based on like race and stature in like government or in a police department, when in reality, life experience is just something that there's no substitute for, and those levels of expertise are often being left out. Another thing that I try to do is like I will set like reminders for myself of anniversaries of people who I know have passed away, right? Like whenever I'm in these kind of conversations, I'm always mindful that everybody or all the reporters on the call may not be beat reporters in the same way that Jennifer and I are. So doing anniversary stories, doing those sort of follow-ups that can provide insight into like which systems are working, like right after someone is killed by a gunshot wound, like what does their insurer do? What is the county office of victim services? What are prosecutors doing? These sort of questions are things that can only be answered by following up with the people who have been injured. And sometimes they are difficult to find, right? We see an episodic story and it's like man killed on block here. And that might be the only thing we ever know about that person. So it's like, I'm never trying to beat up on reporters because sometimes people are truly difficult to find, but that shouldn't stop us from kind of questioning and looking into the systems that they likely have interacted with after being shot. And I think that is looking at the aftermath, following up with people to understand what their experiences have been like with police. Unsolved homicides are always something that are always good to look at. And that's how I feel like I've been able to do gun violence reporting in a way that's different, and hopefully doesn't compound the trauma in the same way that these kind of one and done crime stories have the potential to do, as Dr. Beard laid out so well.
Thank you, Abené. I just want to reiterate your point about experts, because I previously covered gun violence for 2 years in Missouri, with the focus of our reporting being a lot of what we're talking about. And that was something we identified very early on, was like, okay, who are the experts here? It's going to be the community. It's going to be the people who deal with this day in and day out. And I think that is so important to keep in mind in your reporting. When we're talking about doing a better job of covering this, realize who understands this best, but also don't use and abuse them. Cultivate them as a source, just as you would any expert, and be mindful of the fact of what everything Dr. Beard laid out about re-traumatizing from being talked to, from a reporter talking to you. Jennifer, I want to give you a chance with this question too. Thank you.
Yeah. So I started covering gun violence 11 years ago. So right after Sandy Hook. And I've learned in that time on the job an entirely new set of reporting practices that's now referred to as trauma-informed reporting. And this is Dr. Beard's expertise. Sometimes it kind of feels like bending the rules of journalism, because it goes against certain ethics you learn in journalism school or newsroom practices that you've had for years, because like talking a survivor through a story, not just their quotes, but going through the whole story the night before it publishes, so they know there's no surprises, because those surprises can cause real harm and physical reactions in survivors, which is something I had no idea about until Dr. Beard started her work. So, no notoriety. That was another thing that was survivor-led. Survivors, people who had lost kids to gun violence in these mass shootings, were saying, stop glorifying the killers. We don't need to go into every aspect of their background, because of what happened with Columbine. That was a lesson in what not to do. And so there's a movement of, we're only going to say this person's name once, and that's it. And that's something that people listen to survivors, and the media did adapt. I'm lucky that I work at a publication that doesn't rely on daily deadlines or breaking news coverage. So I'm never asked to cold call someone who's just lost a loved one in a shooting, or knock on a grieving family member's door. Those are things that you have to do at a lot of publications when you're just starting out to pay your dues. And it can cause real harm, though. And it's always been something that's uncomfortable for me. I've always been very, very cognizant of the fact that this is the most fragile time in someone's life. And a lot of people feel like they have to talk to reporters. The truth is, and this is also something that maybe goes against what you learned in journalism school, nobody has an obligation to talk to a reporter, period. I know it's all about getting the story and getting a scoop, but I now do something I would probably never do 11 years ago, which is lead with, if you don't want to talk to me, that's fine, because I'm not here to make your life worse just to get a deadline, make my deadline. That's not what this is about. So, I'm very lucky that, we can take our time and write these longer lead stories and really, work with the survivor's comfort level. But I still learn something new about harmful reporting practices all the time, things I never could have imagined. The fact that disproportionate coverage of gun violence generates more gun violence because people buy more guns, and more guns mean more shootings. That blew my mind when Dr. Beard introduced that. The fact that survivors can actually have physical reactions to these unexpected news reports, that is also something that I just had no idea, and many, many reporters do not know, which is why this toolkit is so important. So awareness of trauma in general is something that's new to newsrooms, but it is catching on, and it's also extending to self-care among reporters. We never like to put ourselves in the story. It's not about us. But, sometimes we do need to debrief with people about the things that we're seeing and experiencing and processing, so we can be better reporters. So, it doesn't catch up to us in other ways that affect our work and our sensitivity to other human beings. There's much more attention paid to how these stories affect us. And we don't want post-traumatic stress, later down the road. It doesn't help anyone. So, yeah.
Thank you. just, I mean, phenomenal points from everyone. And I think, gosh, I want to second the "you do not have to talk to me" line. I'm sure editors on the call might be like, what are you talking about? But I think I've led with that too. I think that, and in other stories too, just because people, there's a lack of understanding too of how we work, because we haven't, by we meaning news media, we haven't educated people on how we work internally. And so knowing that you can say no to a reporter is very empowering for a source. And I have found too that they feel more, shocker, they feel more comfortable talking to you. So I think for our final question, I know we're getting close to the Q&A here, but I think what's so important about our discussion today is this is all about a movement in journalism to fundamentally change how our industry covers firearm violence. And to me, this is it's a generational moment, I think, what we're talking about. And it's to me a topic I see that just we really have to change, and we have to do so much better by. And I hope that is a big takeaway for folks today. But I think I want to get into we've got some great specific examples so far from Abené and Jennifer as far as what people can do. But let's talk about what does it mean to move this topic from the typical crime beat. Share some more specific examples. I think Abené did a great job outlining like anniversaries and following up with folks. She had some other ideas too that I think are very solid story ideas. And I know it's a tough question, and because it's a question I have a hard time answering, but I'm going to kick the football on this one. But why is it so hard to get newsrooms to change how this topic is treated? What is the sticking point? Why is this it's a movement, but it is a slow going movement at the moment? And I think I want to start. I'm going to give it back to you, Jen, to get us going.
Sure. Well, it's slow because I'll be honest, what you said about this being generational, it is so true. Right now, young journalists are coming out of school. They've gone through like 4 active shooter drills a year. They've grown up in the shadow of Sandy Hook, Columbine, Sandy Hook, Parkland, and they come out to a reporting environment that does not reflect the threat that they have grown up with. And this is something I've noticed talking to college students who, one of them said to me, I was speaking with a young undergrad, and she was going through an undergrad journalism class. And she said, it's funny. No matter what we cover, no matter what beat we're on, all of us are going to have to cover a mass shooting someday. And I just stopped and I was like, oh my gosh, you're right. Entertainment, sports. I mean, no matter what you cover, at some point, mass gun violence will intrude on that beat. And you're going to need to have these skills. Newsrooms, though, are run by people my age and older who did not grow up. I was in college when Columbine happened. All of this stuff happened after. And so we're a lot slower on the uptake. I'm actually, we don't have any gun violence reporting classes in journalism schools, period. We have climate change reporting classes. Columbia and CUNY don't have any distinct gun violence reporting classes. I'm actually trying to pitch this because it just doesn't reflect what young journalists have grown up with. So, one example though, I mean, and also it's telling, when you go deeper into gun violence reporting, as apparently we're all going to have to do at some point, you do want to find stories that aren't these episodic. So I did want to share one example of one way our newsroom has tried to kind of like buck the trend of falling into this cliche coverage. And that's when I looked at school shootings after Uvalde, like everybody did. My editors were actually the ones who pushed me in a different direction. They're age contemporaries and, Gen X, millennial, whatever. And they're like, you know what? Let's look at school shootings loom large for understandable reasons in the public's consciousness, but how do they compare to other types of shootings? Let's look at, well, are kids safer at school or at home, particularly during the pandemic? And what we found was that for kids, home is a far more dangerous place than school. 3 times as many kids were shot in domestic violence incidents as in school shootings between 2018 and 2022. So for those 5 years, kids were really getting shot at home and not at school. This report, like that reporting was not intended to be like, we should care less about school shootings, but it might change the equation in terms of how we guard against risk in society. Is it worth traumatizing kids by staging 4 active shooter drills a year when they're more likely to be shot by a parent? You know, it changes the resources that we allocate in society to certain types of security measures. Might domestic violence and relationship education prevent as many shootings as a school shooting drill? Or you know, help the response, you know, because you can't, a school shooting drill really doesn't do much to prevent. That's a whole other discussion. But you know, those are questions that reporting out the less obvious angle can really explore.
Thank you. Thank you. Abené, would you like to take it?
Yeah, one of the, I mean, in terms of the reasons why, for me, you know, it's like community violence isn't covered from my vantage point with the same rigor, with the same, you know, indictment of systems as high profile mass shootings. I was just thinking about when Jen was talking about the no notoriety of it all, which is incredibly important. Like I do my best to not include the names of like high profile mass shooters in my story, that I certainly like try to abide by that. But even when we don't do the notoriety, like a part of the mass shooting news cycle is talking to whoever knew the shooter. They will go to their fifth grade teacher, someone who sold them a corn dog at the county fair. Folks will go to anybody who could possibly give any insight into a high profile mass shooter's personality, what they like, what they dislike, anything to try to piece together something so unimaginable that has happened. Like, how can somebody do this to other people? And I'm not saying that we shouldn't try to understand what led to a high profile mass shooting, even if it is from the shooter's vantage point. There are ways to do that can like add value to these conversations and point to like red flags, if you will, that like sometimes people don't pay attention to, but like the evidence for their existence is there. But we never look beyond. But I just feel like there are editors and there are reporters who see even if it is a mass shooting, who see something that happens in an Oakland, in a St. Louis, in a Chicago, and they say, okay, well, there's really nowhere to go with this story now that it's happened. Like, the family doesn't want to talk to us. We can't find any relatives or family or friends of the victims. If it's a child, they might call the school and get in touch with the principal. But I think there's this belief that like, okay, for better or worse, this is what happens in these communities. What else is there to say about it? And I don't think any editor would say that like explicitly, because it sounds exactly like what it is, which is racist. But I really think that's a common belief. That's like, okay, well, what else is there to say about it? There probably isn't going to be an arrest, because in some communities, homicide clearance rates are absolutely abysmal. So like, there's not going to be an arrest. The gun was already illegal, so there's no gun salesperson we can kind of talk to and talk about, you know, federal firearms dealers and policies therein. Like, what else are we going to say about it? And I think that is a tragic mistake, because there's always something to say about it. Like I mentioned, there's always somebody in the community who has been beating the pavement about gun violence, and their expertise just isn't tapped. So I feel like us as reporters saying like, high profile mass shootings, there is more to the story. Day to day, quote unquote, gun violence is just what it is. It happens day to day. What else are we supposed to talk about? And another thing, I mean, I have a lot of compassion for like daily reporters, because if there weren't these kind of daily news stories, these hyper local follow-ups, like it would make it more difficult for me to do my job, right? To like hyperlink to things, to kind of keep track of what's going on in the day-to-day leading up to like a big feature or something that I might do. So I never want to like villainize or make it seem like people who have genuine deadline pressures, right, who may work at a place where like SEO friendly journalism is a priority, like these sort of financial and industry pressures exist and make it hard to do a really good, well done, deeply reported these deeply reported stories on gun violence that you may see a Jennifer or myself do, like it's hard to accomplish that in like a newsroom that may not value that, because it could be a generational thing. I think there are still some folks who see gun violence as like, this is just what Black people do to each other, or this is just what like poor Black and Latino folks do when they get together. And I don't know that belief has been properly excavated within our industry, right? Because that will inform which stories you decide to give a report. And I'm speaking to editors, like that will inform what stories you decide to give to somebody, even if they've expressed like a genuine interest in gun violence coverage. If it's not a priority, a personal priority for you, sometimes you'll say, maybe your time is better spent doing something else, right? And that can really hinder development opportunities for these young reporters who have an opportunity to take this beat to incredible heights. I just missed the like mass shooting, the school shooting, active shooter drill generation. Sandy Hook happened when I was a senior in high school. So I was already kind of out of that age range. But even the expertise that some of our young like Gen Z reporters can bring just from like living under the specter of school shootings and these really public mass shootings is something that we would be doing a disservice to the industry and to survivors of gun violence by not uplifting. So I think that, there are a lot of things that can hinder and stop people from doing the in-depth reporting that all forms of gun violence require. But I really think that two of the main ones I just wanted to reiterate are that people assume that one, there's nowhere to go from a high profile mass shooting story, right? Like, from a community violence story, like it just stops there. We did the like news bulletin, we published the police report. There's nothing else to talk about, and that's not true. And secondly, sometimes it requires deviation from what you see your competitors doing and making space for those, even if it's an anniversary story, right? Even if it's something that's like, mother, father, parent of murdered child does backpack drive. Like there are so many ways in that I don't think we give young reporters the opportunity to explore, that we ought to just take a chance, if you will, and let somebody who has a great idea around gun violence do it, despite the newsroom and financial pressures.
Thank you, Abené. Dr. Beard, I know you're not actually covering this, but you've studied this and you understand this just as well as we do. So yeah, if you can talk about some good examples and how we can move this away from the crime beat, from both your research and then in your work in Philly.
Yeah, I think we've talked a lot about ways to interact with people who've been impacted by firearm violence and how to support humanizing narratives. And frankly, I think that really there's kind of just no excuse for not doing that, if I'm honest. But when I think about sort of this larger idea about how gun violence and more generally crime is framed with the narrators being law enforcement, I think about how that type of reporting is really just reflective of our societal structures and our power structures. And, the fact that, we aren't hearing from public health professionals has something to do with journalism, but it has probably much more to do with the way that we as a country are approaching gun violence. I always think in Philadelphia, I think there's 5 people in the public health department working on gun violence and like 5,000 plus police officers, right? And, one of the questions that I didn't answer before is like, how are healthcare workers impacted by this reporting? And my everyday is gun violence. I'm an expert on, taking care of people who've been shot. And it's frankly, it's sad because it's preventable. People in other countries don't have to have this expertise. And we have lots of solutions that are public health solutions for gun violence. And so when I see an episodic crime report, it's at the very best, it's a missed opportunity to actually talk about gun violence prevention. In our research, I think only 2 or 3 of the 150 news reports that we coded use the word prevent, right? So like, we absolutely need to humanize the victims of gun violence. We need to deconstruct our racist narratives about community firearm violence, but we also need to hold our power structures accountable for the fact that we are not taking a public health approach to gun violence. Like, we haven't failed at that because we haven't done it. And that's the most frustrating thing as somebody who's really responding as on the front lines, if you will, to gun violence, because we have those tools and we can present them to the public as solutions, and we can, include those in every story about gun violence. It's not hard. We can cite experts through their papers. We can frame gun violence as preventable. We can, explain that structural racism is at the root cause of community firearm violence. Like, those things aren't political, they aren't complicated, they're just the truth. And the things that are omitted from episodic crime reports and the perspectives that are missing, like, that's where the real harm is, because we're not helping the public to ask for those things or demand those things when we're talking about gun violence prevention.
Thank you. And thank you three for just such thoughtful and detailed and genuinely helpful responses to these questions. I'm checking out the questions we've had from our people listening in, and we've addressed some of them, kind of hit on some of these points, but we've had some really solid questions come in. So I think this one, which comes from a victim advocate from Philly, what measures can we do to emphasize that the story doesn't stop after the camera goes away? Does anyone want to take that one first?
I'd love to jump on that. A really thoughtful question. Thank you. And I mean, I think it just goes back to those follow-up stories, like anniversaries are always important. Of course, it's doing things. I really think since the data is really poor on unsolved homicides, and a lot of police departments don't like release it super publicly regularly, it's hard to do. But I think that talking about the number of homicides, non-fatal shootings that go unsolved and how that compounds the trauma is something that, is important for any reporter, local, national, statewide, to do, because one, it kind of puts a little bit more of the onus of continued gun violence back on police. You know what I'm saying? Like, there's this assumption that people who shoot other folks, that they just woke up one day and decided to be bad, quote unquote. But I think it's important to understand how much unsolved homicides can lead to retaliation, can compound trauma for like a young person and put them on a path toward shooting somebody else who unfortunately likely may look just like them. Another thing that I think is helpful to explore is sort of the physical impacts of loss on family members. I've talked to a number of parents who have developed like seizure disorders, who have developed like heart issues. I know a couple of people who just like stopped speaking for years on end because of the trauma of losing a loved one. And I think that those sort of stories make it so clear that gun violence is not something that just happens and then someone cleans up the blood and does a funeral and like we just kind of move on with their life. Like, there are widespread community impacts. One of the stories that like just came to mind is like, I did an investigation into gun violence exposure among elementary school children, and a shooting that happens around the corner, a shooting that happens in like elementary school kids live really close to their schools usually. So a shooting that happens, a couple blocks from the school, that just means it's closer to a child's house, but we don't necessarily think about it that way. We don't think about how just hearing a gunshot or coming to school the next day and your friends are chit-chatting like, oh my gosh, did you hear what happened? And there's no like adult to intervene and talk them through these emotions, that can contribute to them going down a bad path mentally and emotionally. But again, we wouldn't know because we don't often ask ourselves like, well, what else? What more is there to this story than just this 17-year-old was shot in a place where a lot of other 17-year-olds were shot? And it's really a matter of follow-up and thinking about those ripple effects and how they impact families. I feel like is none of this is an easy lift, but it's one of it, but it's there. You know what I'm saying? Families reaching out, these Facebook support groups, like looking through those sort of things to see what other stories are out there, to see who else has experienced this sort of thing, I think can really take it from like an episode to an ongoing crisis, which is what it really is.
Thank you, Abené. I think you answered that really well. In the interest of getting through some of these questions, I'm gonna move on. And I'm gonna send this one to you, Jen. There's two here that I think really echo important points you've made today. Which what do you think of the ongoing violent intruder drills that schools regularly hold? It seems that gun violence has shaped our lives in ways that echo the trauma. And then kind of related to it is, what would ideal coverage of mass shootings look like? If you could kind of take both of those.
Yeah, so it's these violent intruder drills. I actually did a story not long ago on each state has its own guidelines. Some states have them once a month. Some states have, sometimes have them a couple times a year. They don't call them active shooter drills. They call them emergency drills. Some of them, they have people dress up. The law enforcement come. These are happening starting in kindergarten. So if you have a child, that child is going to go through, a dozen years of just drilling and drilling and drilling. It moves the cost from, we could solve this problem at the source, but now we're moving it on to the nation's kids. Is it necessary? Are those shooter drills going to actually do anything if there is a shooting? A lot of the time, the shooter is a student. So they've gone through all these drills. They know the security vulnerabilities. They know that teachers will lock doors and leave kids in hallways because that's what they have to do. I mean, this is terrifying stuff. And some states, you have to notify parents the day before you have drills. And I have a friend in Texas who pulls her boys out every time. They're 5 and 8. She said, why am I traumatizing them? If somebody comes in with an AR-15, it does not matter what the security measures are. They're going to shoot through the whole building. So what is the point of this kind of trauma with children? And then I speak to school security experts who say, this is the reality we live with. We have 450 million guns in this country. It's not ideal, but going forward with the cards on the table, how are we going to prepare kids in the event that it happens? So, it's a really fraught topic. And we have a generation of kids who are growing up shell-shocked in a way. And it's the second they get numb, that's when we're really in trouble, because they're growing up and saying, this is not okay. But so an ideal coverage of a mass shooting, I guess, in general, the first thing I look at is, how did the person get the gun? Where was the loophole? Where was the gap in the law? That, to me, I'm looking for like the systems that failed. But also, just keep covering it more generally, jumping a little bit off of what Abené said, keep covering the residual effects of all this gun violence that show that this is not just a problem that happens somewhere else. It's not just the problem that happens in a red state with loose gun laws. It's not just a problem that happens in a community of color. Bullets do not have names on them and they travel far. And, the public costs, we're all paying for this. Taxpayers, money, medical expenditures, strains on resources, like Dr. Beard was saying, the lost productivity, the things we're sacrificing in service of this problem, the loss of the feeling of safety in public spaces, traumatizing kids in school, the fact that it's preventable and that we're all paying this cost. That's what, after the initial coverage of these mass shootings subsides, keeping it in the news by saying, we're all paying for this problem, and eventually they say that like 40% of us know someone who's been affected by gun violence now. That percentage is just going to keep growing.
Thank you, Jennifer. This is a question that's come in, I think, specifically for you, Dr. Beard. In regards to the firearm violence crisis in Philadelphia, how can forensics professionals better address how excuse me while I struggle through this, biophysical social model in gun violence cases, taking into account other social determinants of health?
Yeah, I'm not sure exactly what that question means. So maybe the person can provide some clarification, but I'm not even sure exactly what forensics professionals mean.
Yeah.
Sorry.
Yeah, I agree. So in this one, we've kind of all touched on this in a different way, but I think this is still a solid question. What does equity in coverage of gun violence look like? And why do you think so many newsrooms continue to cover episodes of gun violence instead of the underlying social and economic issues linked to it? I think we've not really touched on kind of, for the public health model. I think Dr. Beard, you did mention this, what does a public health approach mean, and understanding these underlying social determinants of health with gun violence?
Yeah, I mean, well, first off, we know that sort of the reporting on shooting doesn't match the problem. So we talked about how mass shootings are overreported. When we've looked at which shootings are more likely to make television news in Philadelphia, we found that shootings that involve women and children, mass shootings, by our definition, the neighborhood mass shootings, are more likely to make the news. And then we also found, interestingly, that shootings that occur in higher income areas with less racialized segregation and socioeconomic deprivation are more likely to make the news. So like altogether, it's things that are rare that make the news. So I think that, while I understand that that's kind of like what's newsworthy is something that's rare, it's really at odds with presenting a complete kind of public health picture of the epidemiology of gun violence. So I think, I don't think like we're going to change the fact that rare things are newsworthy, but I do think that kind of couching those reports in an understanding of what the true epidemiology of gun violence is, who is impacted the most, and where most of our resources need to be, is important. When we think about like what a public health frame is on a story, like, so there's the episodic crime frame, and then there's the thematic, the more contextual, or a public health frame. We think about these following elements get included. So epidemiologic context, which is what I was mentioning. So, if a shooting is about a child, you emphasize, well, children in Philadelphia represent about 10% of shooting victims, right? So this is still a relatively rare occurrence. You might want to say with adequate research that the rate of children being shot has increased somewhat during the pandemic, for example. Root causes, I think, are important. I think that, what's left out of news stories is as important as what's in. So if we have no contextualization of sort of why gun violence is happening in certain areas in a city like Philadelphia, then, we are just completely kind of affirming this individualistic sort of like ahistoric narrative about gun violence. So figuring out how to include those would be part of a public health frame. The narrators we already talked about, alternative narrators besides police would include ideally a firearm injured person, their loved one, someone maybe that their loved one designates as able to talk about them, but then also, people who are approaching gun violence as a public health problem, people who are involved in community violence intervention or hospital-based violence intervention programs or public health professionals. And I think, that's a challenge because, as I mentioned, there's far less of them than police, and journalists have less access to them. So, there are partnerships that we've been working on connecting both survivors and public health folks with journalists through our center. But more work needs to be done there, and truly more investment needs to be made in a public health approach to gun violence. Visuals that aren't the crime scene, visuals that aren't, the shell casings with the numbers on them, those things are really traumatizing to people who've been shot. And they can be very graphic in some cases. And despite like a lot of kind of conversations about is graphic imagery or explicit narratives going to move the needle, like the truth is that they're probably not, and they're probably just causing more trauma to people, and certainly are firearm injured people. And we're also doing another study with experts on gun violence, and everyone's kind of coming to the consensus that graphic and explicit content is harmful. And then finally, we haven't talked that much about solutions, but those, really exploring solutions and making that be a part of your reporting, I think would be a public health frame, obviously, because in public health, we have lots of solutions to gun violence. And it doesn't necessarily mean that we uphold something that's not going to work. We can say these are proven solutions. There's lots of resources to cite. The Johns Hopkins Center has a whole page on what are proven effective policies for gun violence prevention. So, there's experts that you can also cite that aren't necessarily right there. They're experts that are available that have information for you and resources for you. So hopefully that helps.
That's very helpful. And I think it's a good reminder too, just data wise, that we can find a lot of overlap with other public health issues and rates of shootings. You can find it with unemployment. You can find it with poverty levels. You can find it with poor funding for schools, food deserts, vacancy and blighted land. Like there are lots of story ideas to show how these other public health failures that these communities deal with intersect with gun violence. Might not necessarily cause it, or there might not be proof that it does, but it's important to know that these conditions where shootings happen overlap with other real problems that these people are dealing with. So thank you, Dr. Beard, for outlining that. This next question, I think, will probably be our last, and I think it's a really important one, and it's a reminder that, gun owners are a part of this conversation as well, and they're important sources on this as well. So I'm going to read the full question because it's very strong. I'm looking for best practices to cover gun violence, gun-free zone laws, and balance that with legal gun owners and stand your ground laws. Over 70% of people in my rural North Carolina county own a legal gun, but then someone drives an hour to Charlotte, there's more gun-free zones. I know of a few locals have been arrested there for carrying what they thought were their legal guns. So I think kind of to make it they're looking for best practices for covering this, but I think making the point that we can't forget about gun owners when we're talking about this issue is really important. And as far as how it intersects with laws, I know that varies state by state, but Jennifer, can I kick that one to you?
Yeah, absolutely. We always try to talk to gun owners. The conversation has been hijacked by the most extreme voices on the right, and that leaves out the vast majority of gun owners who will never do a law-breaking thing in their lives, who operate guns totally safely. But this rural-urban divide is something that I've covered a lot in my work. And the attitude toward law enforcement, the attitudes toward guns are very different when you're coming from a rural area to a more populated area where people are more likely to bump up against each other. And so, and conflicts ensue. And if you have guns, you're more likely to reach for one. And so, but in rural areas, law enforcement could take 30 minutes to get to your house. You could have a farm. You need firearms for other things. And, there is more of an understanding about that on the gun safety side of the conversation. A lot of people who are talking about gun safety actually own guns. But, understanding that, well, first of all, in most states, cities can't make their own gun laws. Only the state legislature can. And that usually means that the state legislature is very permissive. So I don't think that Charlotte is, I could be wrong, banning guns, or these are probably private businesses and government buildings that have designated their area gun-free zones. There's always going to be places in society where people can't carry guns, no matter what. Even if we had absolutely no restrictions on access, there will always be places. And so understanding from their point of view why that's frustrating, I think, we're all trying to do that when it comes to the whole MAGA movement. We're trying to talk to the other side to try to bridge some kind of divide, get common ground. With gun owners I've spoken to, when you take it out of a political context, it's a lot easier than you think. We have a lot of things in common, and just really trying to put yourself in their shoes and understand why this would be frustrating to a city dweller. It's like, well, I don't get it, and part of reporting is putting yourself in those shoes. So again, though, laws are very different when you go from city to city, county to county, and that's our next conversation, all the data blocks. Schedule that one.
There we go. Okay, I think this is a great place to end it. Thank you three so much for just a wonderful conversation. And I really hope everyone who tuned in leaves with some story ideas and some ways to do this better. So I'll pass it back to you, Bara.
Thanks so much, Caitlin. I just want to echo that. I've learned so much from this really thoughtful conversation. And I know that we all talked about how the four of you can be an ongoing resource for journalists out there who want to deepen their coverage of this topic. So for those of you who've been tuning in, please reach out to the panelists here. And I just want to thank you all for joining us today. We'll share the link of the video soon, and along with resources that were mentioned here today, so you can keep mining this conversation for guidance. And again, I just want to thank you all for being here today, and we hope to see you at another National Press Club Journalism Institute event soon.